how quickly can you see signs of a cow's milk protein allergy after reintroduction? Really good question. So when we are reintroducing cow's milk protein, the timeline that we'll typically see is either an acute reaction or a chronic reaction, are the two categories. An acute reaction is one that happens fast and heals fast. And so an acute reaction is going to be hives. So these are IgE-mediated reactions like hives, anaphylaxis, swelling, things like that. Or on the non-IgE mediated side of the house, what we more often are going to see is reflux, vomiting, and some rashes. So any of the upper GI issues is an acute reaction, and some of the rashes are acute reactions. And so those acute reactions, happens fast and heals fast, are going to happen either immediately when baby's exposed to the cow's milk protein, if that's their trigger, or up to a few hours after ingestion. Let's say baby is consuming cow's milk protein at noon and vomiting is their typical response. Maybe they have FPIES, which is commonly, not always, but commonly a profuse vomiting reaction. So baby consumes cow's milk protein at noon, and at 2 o'clock, you get a profuse vomiting response. Either one big vomit or many vomiting reactions, one after another. That is an acute reaction. Typically after the peak of the reactivity, they're feeling good. Happens fast, heals fast. So they're feeling better pretty fast. Sometimes for some of us, the vomiting gets so bad that we end up having to take them in because we may be worried about dehydration, which is totally valid, and they may need some Zofran to get their belly settled. And other kiddos, they vomit and then they're doing great. They feel great. Now, the chronic reactions is something that takes longer to happen and takes longer to heal. So an example of that is going to be other rashes. So some of the eczema responses that we see are chronic and they take a little bit longer for that full peak reaction to be seen. And any of the lower GI reactions, because the lower GI reactions are literally happening when that protein reaches that area of the body. So it takes a little bit longer for that protein to get to the lower GI tract, and then we see a reaction. Also, typically the reaction that we see for those lower GI is literally the stool, and so we have to wait until we get the stool. And so for some kiddos, they're stooling on a regular cadence and we see it fairly quickly, and others is a more delayed response. It takes a little bit longer because maybe they're not stooling except for every other day, for example. So with the chronic reaction, the sweet spot, most common window that we see for reactivity is around 6 to 8 hours after they've been exposed. So in the same scenario, I give baby cow's milk protein around noon, and then I see a bloody stool or diarrhea or constipation. Any of those lower GI reactions, I'm gonna see around 6 to 8 o'clock at night. But maybe baby doesn't stool at that time. Maybe I don't get the stool until the next morning, and that's when I see the blood in stool, or that's when I see the excessive mucus in stool. So the full window then for a chronic reaction, more often than not, there's always outliers, more often than not, is 6 to 48 hours after ingestion. And I know that's hard to hear because you're like, okay, well then I gotta wait 2 days. This really is dependent on how frequently your baby's stooling. So if your baby's stooling on a normal cadence, you likely won't have to wait that long.